Might have to take a FTA. Alright, 24.
Two.
This tooth, I'm sure you guys remember, I presented this case a few days ago. Root canal was done originally 5 to 10 years ago, according to the patient. But 3 months ago, his crown was redone. So the crown is only 3 months old. And then a few days ago, patient started to have some symptoms, pain, and what have you, and went back to his dentist. PAs were taken, and they noticed the periapical relucency. And the point that I was making in the previous video was that please, before you put a new crown on a tooth, take a PA, take a bite wing, cold test the tooth if there's no previous root canal, just to make sure everything is okay before you put a new crown on the tooth. Anyways, so today patient came in so we can redo this root canal for him, and as I said, unfortunately we had to go through his brand new crown to do it. So went through the crown, removed all of this gutta percha. We did selective endodontics. Distal is fine, so why mess with it? And the canals were obturated with gutta percha and BC sealer, which is bioceramic sealer. And bioceramic sealer is a bear to remove. It literally feels like going through concrete in some cases. And that was the case here, because if you put a gutta percha core from the coronal to the apical and then BC sealer around it, it's fine. But the problem is that if you don't have a patent canal and you push the BC sealer and you fill part of the canal with the BC sealer and not the gutta percha, that's where there's a problem. When there's a problem, I had to regain patency, and the apical parts of the canals were only filled with obturated with BC sealer. And as I said, going through the BC sealer when there's no gutta percha core in the middle is like going through concrete. But I had to regain patency because of the periapical relucency there, and as you can see, I was able to. Everything went beautifully, as you can see. 2 separate mesial canals, troughed for middle mesial, wasn't there. And look at that beautiful anastomosis between the mesiobuccal and mesiolingual canals. And as I said, we got patency here as well. This is another angulation. Another angulation. and another angulation. We went ahead and temporized the tooth and referred the patient back to his dentist. I told him, don't get a new crown yet. Have your dentist replace my temporary filling with a permanent filling for now. Come back and see me in 6 months. I want to make sure this is gone.